Ever thought that the medicines you take to stay healthy might actually be hurting your brain? It's surprising but true that some of the most commonly used drugs, taken by millions daily, are tied to serious dementia risks.
Yes, you heard that right.
Even though these drugs might help with other health issues, they could be quietly harming your memory and thinking skills. But don't worry, there's a silver lining. Today, we'll uncover which medicines carry these risks and explore ways to protect your brain health. Stay with us until the end because there's a special bonus, a natural approach that could help handle these conditions without risking your brain health. You won't want to miss it. Let's begin with the big question. How can medicines designed to keep us healthy actually raise the risk of dementia? Certain drugs, especially those with anticholinergic effects, block an important neurotransmitter called acetylcholine, which plays a key role in memory and learning. By interfering with acetylcholine, medicines can impair brain function over time. For example, proton pump inhibitors, PPIs, like omeprazole, used for acid reflux, have been linked to a higher dementia risk. A study with over 6,000 people showed that about 10% of those taking PPIs for 3 years or more experienced memory loss. Shocking, right? This doesn't mean you should stop taking your meds right away, but it's important to know about the risks. Always talk to your doctor before making any changes. The goal is to manage your health conditions without affecting your brain health.
Now, let's talk about anticholinergics.
These are drugs that prevent acetylcholine's action and are used for a variety of issues, from bladder problems to Parkinson's disease. Even though they can be very effective, there's a downside. Long-term use is clearly linked to dementia. A University of Washington study followed over 3,500 older adults for a decade, and those who regularly used anticholinergics had a 54% higher chance of developing dementia. That's more than flipping a coin. Common anticholinergic drugs include diphenhydramine, found in Benadryl, and oxybutynin, which is often used for bladder control. If you're taking any of these, it's time to chat with your doctor. Safer options may be available that don't carry such high risks. And by the way, if you've ever taken any of these medications, share in the comments how they made you feel. Did you notice changes in your memory or focus? I'd love to hear your stories. Next, corticosteroids. These powerful medications, like prednisone, are often used for inflammation, asthma, and allergies. But the catch is that long-term corticosteroid use can cause changes in the brain, leading to confusion, memory issues, and even an increased dementia risk. A large UK study with over 500,000 people found those on long-term corticosteroids had a significantly increased risk of developing dementia. Here's why. Corticosteroids can affect cortisol levels, which is the hormone that manages stress. If cortisol is high for too long, it can harm the hippocampus, the part of the brain that controls memory. So, if you're taking corticosteroids for a long time, make sure to keep reviewing your treatment with your healthcare provider. They might adjust your dosage or look for different therapies to lower any risks. Medicines called benzodiazepines like Xanax and Valium are often given for anxiety and trouble sleeping. They can be really helpful for serious anxiety, but there's a big downside. Using benzodiazepines for a long time can double the chance of getting Alzheimer's disease. A study found that more than 40% of long-term users had major brain problems, such as memory loss, trouble focusing, and even being overly sensitive to things. These medicines can mess with brain chemicals, causing lasting changes in how the brain works. Think of it like driving a car with the brakes on when using benzodiazepines for too long. You might move forward, but you're causing damage as you go. If you've been on these drugs for a while, it's important to try other ways, like talk therapy or relaxation practices. These can help with anxiety without putting your brain at risk. If you've ever used Benadryl or other older antihistamines for allergies, you might be shocked to know they are linked to a higher chance of dementia. They work well to stop things like sneezing and stuffy nose, but they also block acetylcholine, an important brain chemical. A recent look at 13 studies showed a strong connection between using older antihistamines for a long time and memory problems. People who took them regularly reported issues with memory and focus even after stopping. The good news? There are better options now. Newer antihistamines, like loratadine, don't have the same risks and work just as well for allergies. So next time you need allergy medicine, pick one that's safer for your brain. Tricyclic antidepressants, like amitriptyline, were some older medicines for treating depression. While lots of people benefited, they can cause big side effects like memory issues and thinking problems. Research shows people taking these antidepressants regularly have faster drops in brain function compared to those who don't, especially in older folks. Why? Because these drugs have strong effects that block critical brain chemicals for memory and learning. These days there are safer medicines like SSRIs which don't affect thinking as much. If you're on a tricyclic antidepressant, it's a good idea to talk with your doctor about different options. Medications like atorvastatin and simvastatin are commonly given to reduce cholesterol levels and guard against heart attacks and strokes. However, more research is indicating that these statins might have a negative effect on brain function. Some studies suggest that people who use statins for long periods can experience issues with memory and mental confusion. The belief is that statins might disrupt the production of cholesterol in the brain, which is vital for forming synapses and maintaining cognitive function. Now, here's a little extra I mentioned earlier. Did you know some over-the-counter drugs might increase your risk of dementia? Medications such as sleep aids and allergy pills can be just as risky as prescription meds if used for a long time. Diphenhydramine, which is in over-the-counter sleep medications like Unisum, has been linked to cognitive decline. You might think these are safe since you can buy them without a prescription, but the risks are very genuine. Always check the labels on over-the-counter drugs and talk to your doctor before using them often. Often, safer non-drug options can help you sleep better or handle allergies without endangering your brain's health. Now that we've covered the 8 medications that might heighten the risk of dementia, here's the special bonus I promised: natural alternatives that could help you manage these issues without risking your brain health. Number 1. Melatonin for trouble sleeping. If you've been using benzodiazepines or sleep aids like diphenhydramine, think about trying melatonin. This natural hormone helps adjust your sleep cycle and can boost sleep quality without affecting memory or brain power. Number 2. Chamomile or valerian for feeling anxious. For those who use benzodiazepines for anxiety relief, you could try chamomile tea or valerian root. Both have been used for hundreds of years to encourage relaxation and lessen stress without the dependence or cognitive problems. Number 3. Ginger or apple cider vinegar for acid reflux. If you're worried about using PPIs like omeprazole for a long time, ginger and apple cider vinegar are natural remedies that can help ease reflux symptoms. These could lessen the need for medications linked to dementia risks. Number 4. Mindfulness and relaxation exercises. Instead of depending on drugs for anxiety or stress, you might try mindfulness meditation or deep breathing exercises. These techniques have been found effective in managing stress and boosting mental health without the side effects of medication. So, there you have it, 8 medications that might be quietly harming your brain. The key thing is, while these drugs can be necessary for treating some conditions, staying informed and alert can aid in making better choices for your long-term health. If you're taking any of these medications, don't worry. The key is to have an open dialogue with your healthcare provider about the risks and benefits and to look for safer options when possible. Before we finish, leave a comment. Is anyone you know, or are you, using any of these meds? Have you observed any shifts in memory or focus? Let's exchange stories and help one another stay updated. If this video was useful, be sure to click like, subscribe, and ring that notification bell to catch all our upcoming health updates. Thanks for tuning in, and I'll catch you